Hello guys, welcome to Gigi Han channel. This is Gigi Han's first live and I am so lucky to have Dr. Kenneth Wong with me. Yeah, hi Dr. Kenneth Wong.
Hi, Gigi Han. How are you?
Hi, I'm great man. How are you?
Yeah, I'm fine.
Yeah, sorry, you were saying?
Never mind. You continue. Sorry, you continue.
Right. So glad to have you here. I don't know who will watch this. This is Gigi Han's first live. We didn't do any announcement. Yeah, the purpose of us doing this live is actually to talk about a little bit about your history a year ago. And also we want to talk a little bit about eye health, like what we have shown down here at the banner. And yeah, so the first thing first, what we will do is we go back to 1 year ago. So Dr. Kenneth Wong, damn power. Okay.
No money. No power, no money.
Yes. So what happened last year? Let me show you guys. Let me show you. Yeah. See, 1 year ago, Dr. Kenneth Wong had this post talking about it has a relation between this international channel Al Jazeera, and then they make a documentary criticizing Malaysian government treating the party, right, the illegal immigrants, treating them very inhumanely. But actually, Dr. Kenneth Wong was in MAIPS, the quarantine center himself, and he was actually one of those frontliners that were treating. You were there for how long, Dr. Kenneth Wong? 1 year plus,
one month. 1 month and one week.
Right. So what he did there was he was treating all the party, the illegal immigrants, and he made a post. This is the one that you are looking at it now. He rebutted the points that Al Jazeera did. And look at this. Whoa, man, almost 40,000 like and share. What? Over 30,000 shares. This is a crazy number, man. Well, okay, so time flies.
Yeah, time flies.
1 year already, bro.
Younger now.
Younger and wiser. So time flies. 1 year has passed, and still, bro, we are still talking about COVID. Can you imagine that?
Not done yet.
So are you still dealing with the not just illegal immigrants? Are you still in the front line yourself currently?
No. Actually, since then, I went back to my original department, ophthalmology department at Hospital Selayang. So I'm not doing COVID rotation. But somehow, sooner or later, most probably in the coming months, I'll be going back to COVID rotation too. Because most of my friends in my department, we are sent to the COVID posting. So each month, about five of us will be sent to MAIPS, either to MAIPS or the medical COVID rotation at Hospital Selayang.
Okay. So
most of the cases now, we do not send to MAIPS, and it can be treated at Hospital Selayang itself. Whichever hospital in Selangor or KL, all the hospitals mostly are hybrid.
Hybrid? What do you mean by hybrid?
Hybrid, basically, half of the beds are COVID patients, half of it is non-COVID. Because in Selangor and KL now, only 2 hospitals are fully COVID, which is Sungai Buloh and Ampang. The rest are all hybrid.
How do you think about this situation now?
It's a big difference from last time until now. Because last time, you see my picture there. That time, I still remember, whoa, we're so happy. 0 cases. Even the minister,
MAIPS were closing down.
MAIPS closing down. Even the minister came, closed. Then after 1 month, 2 months, cases rising back. Until now, you can see, the cases are all more than almost 10,000, reaching 10,000. So many deaths per day. Yeah, and we are still going round and round. Yeah.
How do you feel, man?
I mean, it's difficult for everyone. Challenging, especially for our friends in the frontliners, because they have to face much more challenges. Because now, as cases are rising, people have to work more hours and work harder. You can clearly see in social media, all the hospitals in Selangor and KL. You can see why videos going on, right? You can see,
Yeah.
the emergency department is full of people.
Are those true?
Yes, it's true. And probably at a single time, there could be up to 100 COVID positive patients in the emergency department, even more. So actually, if
I-
you are sick, let's say you broke your leg, you go to the emergency department, you don't have COVID, you might get COVID there also, because there's so many COVID patients all around. So it's quite dangerous lah, and the condition is quite critical now, as we can see.
So when your colleagues and yourself, you all go for rotation, do you like go for a period of time, then you come back to the department, and then you get rotated there again? How does it work?
True, that's how it works. Because my department, ophthalmology, is considered non-medical COVID. So people from our departments will be dispatched out to MIAPS or dispatched to medical COVID. Departments like me, like maybe ENT, plastic surgery. So we have many MOs lah, many medical officers from different departments, helping out in the medical COVID rotation.
Okay, so we get a question here. I heard Sungai Buloh is closed. What did he mean by that? Maybe can you explain us
From
about
what
this?
I see, I don't think it's closed. Probably because it's full. They are still handling cases. You can still see patients going to Sungai Buloh Emergency Department. Their ICU is always full. Their wards are fully packed.
Oh
This is
man.
happening in the whole Selangor lah, basically, and KL, of course. Yeah.
Wow. Why do you think there's such a big difference, like from KL and Selangor compared to all other states?
From what I read is maybe it's because of the Kilang, because many clusters are from there, and also because Selangor and KL is a populated area, as you know. That's why the cases are rising. Yeah, and it's even faster now. Don't know how many strains there are. I cannot keep track what strains there are in Malaysia. Yeah, and also the vaccination. They're trying to increase the vaccination rate in Selangor. Yeah, and also KL.
Even I myself got a call from KKM asking me whether I can go and help out the vaccination duty. But the thing is, they are now even reaching to the private dentist now. Yeah. Then
because they are in need of people. They are in need of people.
manpower, right?
Is it PPV? They call it PPV lah. Pusat Pemberian Vaksin all over Malaysia. Yeah.
Yeah. All right. Let's go back to this post on the screen now. So once that happened, right? How your life has changed since then? Can you let us know? What kind of interesting stories or what kind of interesting people you met along the way because of this post, or what are stories? Tell us some stories, man.
You mean stories now or stories before? Sorry,
No,
I didn't hear you.
from that viral post that you're seeing on the screen now, what kind of changes it made to your life, or do you experience anything interesting since last year July from that post until now? Can you tell us some story?
What I can say, it's not to say it's a very big life-changing experience, but it is a truly interesting experience after sharing that post, because we create awareness to everyone of what frontliners are actually doing. And actually, what I post back then cannot be compared to now, because the situation now is much, much worse. Much, much worse.
All right, agree.
Then everyone is celebrating, but now actually it's very, very bad. And you can see so many deaths per day, So actually, throughout these few months, actually we can see many of my colleagues actually becoming COVID positive. So it's
even your colleagues.
So my colleagues itself. So actually, not only the patients are getting sick, even the doctors are getting sick. The thing that we are worried is, if the doctors get sick, then the healthcare system will be affected. Then it will affect the whole system as a whole. So this really affects everyone's life lah. and it is always sometimes if someone gets close contact, then you have to be quarantined. You have to be quarantined, have to swab. Then maybe your swab will take 3 days. Then you won't be there. So we have lacking of manpower at certain times. And I believe this is happening in every department in the Ministry of Health. Throughout the past maybe 1 year or 6 months, things have been very fast moving. So one moment suddenly your friend will say, oh, I'm close contact, or maybe, I'm not feeling well, then we are worried, because sometimes, with your colleagues,
Yes.
you eat together, then you don't wear mask when you eat, right? I mean, yeah, when
Exactly.
you maybe in the same room, then you feel so worried and scared, then you're praying that your friends will be negative. Yeah. So things are really different. We used to sit together, eat everyone, but now everyone is so worried,
Scared, worried, yes.
So yeah, because the threat is real. The threat is real. Yeah, people are really falling sick. Young people are dying. Yeah, majority is elderly people, but young people are also dying. Yeah, so it's quite a bad situation now.
So some are saying we can use this nose mask to use it when we are eating. What is your opinion about this nonsense?
So far I haven't seen any of my friends wear those type of masks lah. Or nose, I haven't seen it before lah. Yeah, if they
Got
see,
money
I
also
want to take a
cannot buy.
photo. I want to take a photo of it lah.
See like that. Oh well. I think we drifted off a little bit. It's someone from not South America that developed this, that invented this thing. But I don't see a point of this. Anyway, let's go back to your post. Yeah. Any other changes that you realize, or what kind of interesting stories you met along the way? Oh my God. So sorry. This is your. Let's turn this off. Stop screen. Yeah. From that post itself, did you get any more interesting stories that changed your life or
Interesting.
interesting stories? You got some interviews. Tell us about interviews. I mean, besides Gigi Han is such a small channel. Yeah. Any
No
other?
we subscribe
Hey,
to your
come
channel.
on. Hi, thank you.
Interviews, yes, a lot. Yeah, interviews. Yeah, a lot of interviews. After that, then friends used to make fun of, not make fun lah. They used to say, "Oh,
Wang Hong.
They used to say, "Wow, you're a COVID warrior. You're a COVID warrior fighting COVID."
Spokesperson.
Then I tell, huh?
Spokesperson.
Then I tell my friend now, hey, you also becoming COVID warrior. Everyone will have the chance. Don't worry. In the coming 6 months, everyone will have a chance to become COVID warrior. Not only me, not only I get the chance to go MIEPS. Now even you get a chance to go MIEPS. Yeah. And even some of my friends they are becoming COVID survivor, not COVID warriors.
That's really sad to know. Even you all are so precise and careful with the PPE, with the hazmat suit, everything. Still, things can slip.
Yeah, because it's in the community. It's sporadic. In the community, nobody knows who has COVID. Maybe no symptoms. I got a few friends who no symptoms that get COVID. Then some got symptoms, no COVID. You never know.
You're right. Has everything settled back to normal since last year? Or
nothing is normal. I mean, nothing is normal compared to last time. Yeah. Like example, in my eye department now, we are only doing emergency cases in the Selayang Hospital, whatever that's emergency we are doing. I think, cases that are not emergency we are not doing. We try to limit the number of patients coming to the hospital. We don't want patients to get COVID after coming to the hospital because some of them they are well. So like now it's a bit. I wouldn't say troublesome, but it's a bit more specific. Like, let's say the protocol. Let's say you want to do operation, you have to take COVID swab first, a PCR or RTK. So you have to be admitted maybe 3 days before. Then we will take your COVID PCR. Then after that, we wait for the results. Then only we proceed for operation. If it's really urgent, then they'll take one RTK. Yeah.
What kind of emergency are your department accepting?
I mean, what not to say what we are accepting or not, but because Selayang Hospital is actually one of the referral center
Correct.
for vitreoretina, so all the cases somehow still comes from many hospitals. For example, like Ampang and Sungai Buloh, they send all their cases to Hospital Selayang because their hospital became full COVID, so they have to send their patients somewhere, right? They'll send their patients to us lah. So a lot of emergencies like trauma or retinal detachment and things like that.
Trauma to the eye. Oh, yo, that's really unlucky. Oh, thank you, Friskila. Thank you. She said, good night, doctor. Always healthy doctor with family. Thank you, thank you. All right. So since you are in Department of Ophthalmology, I would like you to share a little bit health information with the viewers on Gigi Han channel. Yeah, why not? We start with something simple. Is there a difference between an optician, an optometrist, and also an ophthalmologist? Yeah, these three terms may confuse everyday person. Oh, oh, I think we have lost Dr. Kenneth Wong. Hey,
hello, can you hear me?
Doctor.
The stream got issue, is it just now? There's a bit of technical error, is it?
I lost you for a while. Then you came back.
Sorry, can you hear?
Yeah, I can hear you now.
Okay.
I lost you for a while,
okay.
and then you came back. Yeah.
Okay.
So yeah, my question. No, it's okay. Now we are back to normal. Fine. Yeah, Malaysia fiber broadband. So
heavy rain now. It's raining now.
It's okay lah. You're not using Astro, right? Yeah.
Maybe my camera
so yeah, the thing I was asking is, what are the differences between optician, optometrist, and ophthalmologist? The public may not know the differences between these three.
Okay, so ophthalmologist is basically a doctor who specialize in the field of the eye. Ophthalmologist. So, for example, a cardiologist specializes in the heart. Ophthalmologist specialize in the eye. So you can see ophthalmologists in the hospital. Optometrists are actually professionals trained who can provide what you call that, sight testing and also correction to diagnosis. They also actually assist the ophthalmologists in the hospital in coming to a diagnosis. So they are also considered professionals, healthcare professionals. Then opticians are actually people who are trained to do proper refraction, where they can make glasses for you at the shops outside, where you can see, most of the shops, optician shops. Yeah. So that's actually that's a short summary of what is the difference between the three.
All right. Believe it or not, a lot of my followers are actually seniors, right? So since all my videos are quite boring, so boring but informative, then I would attract that kind of age group. But anyway, diabetes is a very common condition in the senior age group. So how is diabetes and the eye diseases, are they related? Can you tell us more about this diabetes eye diseases?
Okay. Can you before we continue? Can you hear me clearly? Can you hear me?
Yeah, definitely. Yeah. I can.
Okay, sure. Okay, diabetic eye disease. Okay, so diabetic eye disease, to your surprise, it doesn't only happen in the elderly, but nowadays actually happen in younger people. Okay, so for example, there's many cases in Hospital Selayang. We can see young people, maybe age around 30s. Like maybe your age or maybe younger than you. They actually come to the hospital, they complain of maybe, doctor, my eyes, I only can see a black patch at the center. Then you're like, so young person, what can it be? So when they dilate the eyes, when they see these patients, they actually have diabetic eye disease. So not only in elderly, not only
Undiagnosed
old,
prior.
yeah, but it's actually young people, 30s, people in mid 30s. So diabetic eye disease actually happens when your diabetic is poorly controlled. Your diabetic status is poorly controlled. Then new vessels actually can grow in your eyes. Then it can
Wow.
lead to bleeding. Then it can lead to retinal detachment. Yes, and many other problems. Yep.
Wow. Let's say, if they have this issue, well, controlling their blood sugar level help in any way?
Yes, actually, lifestyle changes is actually one of the first way a person should take in controlling diabetic eye disease, which is stop smoking, controlling what you eat, controlling your sugar, taking your medication at the proper time. Don't miss any follow-ups, medical follow-ups, because if you don't go for proper follow-ups, then eventually you'll come back to us. Because most of them with diabetic eye disease, you can see their sugar levels are very high, their HbA1c is poorly controlled. You will know when you ask them. When you ask them, they'll tell you, yeah, the patient will tell you, most of them won't cheat, they'll tell you the truth. Then you're like, okay. And
Usually,
one
how
thing about
long
diabetic eye disease,
between?
sorry?
How long would, when the condition started until they have diabetic eye diseases? Usually, how long it would take?
It's very difficult to say, because some patients might be faster progression, some might be slower progression. Some you can see maybe they come at 40 years old, bad already, the eye is very bad, full of bleeding and also retinal detachment and also fibrous tissue in the eye. But some can be very young patients also. Yeah. So we need to understand that diabetic eye disease, there are three main types, which is basically four types, mild non-proliferative diabetic eye disease, moderate or severe, or it can be proliferative diabetic retinopathy. Four types. So your management actually is based on the four types, and we will decide the treatment based on it.
What kind of treatment usually
Yeah.
goes along with diabetes eye diseases?
Okay, if it's just mild, moderate, we can actually treat it with your lifestyle changes. Just control what you eat, control your sugar. Then we'll monitor you closely, maybe 6 monthly, or maybe 8 monthly, or maybe even a yearly follow up. If it's severe or a very severe diabetic eye disease, or maybe even a proliferative diabetic eye disease, we might need to give you a laser treatment. Laser, not the laser which is LASIK lah, but this is actually laser at the back of your
Or
eyes.
different type
We
of
will shoot
laser?
different type of lasers. Yeah, this laser will shoot the back of your retina. We will shoot so that all the new vessels will not grow, because we worry when when your sugar is not well controlled, there will be new vessels forming in your eye. So we do not want that, because when new vessels form, it will lead to bleeding and it will lead to fibrous tissue forming in your eye. Then when that happens, it will lead to retinal detachment. That's why we must stop the root cause, which is we do laser for your eyes. So it'll take maybe 3 to 4 sessions or maybe 5 sessions. And if you have very severe eye disease, maybe we'll monitor you every 4 months. Yeah. So if you have diabetic eye disease, make sure you get eye assessment yearly, at least once per year.
Oh,
You can go to the nearest clinic kesihatan. They will do a fundus photo for you, yearly fundus photo. They actually have a
what is
camera.
fundus photo? All right.
Yeah. They actually have a camera to take photo of your eyes. Then, if they detect any changes, they will refer you to a tertiary center, which is the hospital, for further management.
Oh,
Yeah, so
cool,
it's like a
cool, cool.
screening thing lah in the clinic kesehatan you can do, but make sure at least once per year. Because I know many diabetic patients, 10 years diabetic, 20 years diabetic, never once check their eyes before. Then when they come, it's too late. It's very common,
Why
It's
were they
they
not? They should be referred, right?
no, not. I mean, Maybe they didn't go, or maybe they were not referred. We are not sure. But this is a very common scenario. It happens every day in the eye clinic. Patients will come to you lah, say kecil manis or something, dah 40 tahun, tak pernah check mata. When they come, boom, it's already very advanced. Then what you can do, what doctors can do is to slow the progression only. We cannot somehow turn it around, right? When damage is already done to your eye. Yeah, it's too late. So it's better to detect early than to detect late. Yeah.
So if the condition is detected early or moderate stage, it can still somewhat reverse to a healthy level. But if it progresses into an advanced stage, then it cannot be reversed anymore.
Not to say reverse 100%, but maybe to slow down the progression. Slow down the progression, yes, and prevent worsening.
All right. How would the anesthesia be during the laser procedure?
Laser actually is a very simple outpatient procedure, I can say. You just come to the clinic, we'll explain to you what is it about. After that, we'll get your consent, we'll get your signature. What we're gonna do lah? Basically, we're gonna put some eye drops on your eye to anesthetize your eye. So we won't give any injections or anything. We'll anesthetize your eye with an eye drop. We'll dilate your eyes. Then after that, you go to the machine. You know that machine where people check your eyes, right? You put your head there, then you just look straight, and the doctor will shoot the laser. Yeah, so the doctor will explain to you what's the risks and complications of laser, because doing whatever procedure we do, we have complications, right? So the doctor will explain to you, then you give your sign, then we can start the procedure. Usually it will take around maybe 15 to 30 minutes per eye.
Oh, so fast.
Per eye.
Per eye.
Yes, per eye.
So it's sitting down procedure, not laying down.
Not laying down, sitting down procedure.
Oh, okay. How about anesthesia part?
Yeah, we just
No
put
anesthesia.
eye drops.
Eye drops only. Oh, okay.
Yeah, eye drops only. That one is like a numbing thing lah. Easier term is like it numbs your eye. I mean, you cannot feel pain to reduce the pain. Yeah.
It's awesome.
And also when we do the laser, we'll we'll monitor the power lah. We can reduce the power if it's too painful, or we will increase the power if it's not enough uptake. So it really depends, If you're pain, you just tell the doctor, then the doctor will reduce the power.
At least, there's no needle poking into your eyes.
Yeah, there's no needle poking into eyes. Probably you feel discomfort. Maybe not pain, but maybe discomfort. Yeah, there's a difference between discomfort and pain. Yeah. But I always tell my patient, you do feel a bit of pain or something, because if it's no pain, then it's not working lah. You must have like a bit of feeling to it. Means we are hitting the retina properly. When we are doing the laser, or else you don't feel anything, means the power might not be enough. So it really depends on the person shooting the laser. So it's based on experience when you shoot the laser. Yeah.
I am thinking like Star Wars.
Yeah, there's actually a lot of things to it. Diabetic eye disease is a very big, big topic. You can actually go online if you read. I think you can read one day or so, not enough. There's so many things and procedures we can do. Yeah.
Question from viewers: how to control from food? Please recommend. I think she's talking about the whole diabetes itself, right? Can you give some short recommendation for them?
So food, basically you avoid sweet stuff. Example, food like sugary stuff, you avoid all those stuff. No, actually, the food control is actually same as your disease itself. As in, like when you have diabetes, you control what you eat. Like you don't want to eat sweet stuff. When you have hypertension, you don't eat salty stuff. It's actually the same. It applies together. Yeah, because the eye disease is actually a complication from your uncontrolled diabetes. So if you control your diabetes from your food, then your eye disease won't happen. Yeah, so it's the same lah. Avoid the sweet stuff and everything. Like people will tell you the same thing lah. Don't eat too much. Don't eat McDonald's every day and things like that. Yeah.
How about the other aspect of the lifestyle besides food?
Lifestyle, as I said, smoking, healthy lifestyle. All this will help.
Yeah, actually, everybody knows how to be healthy, but not many people can go and implement it really go and implement it. It's so easy to say, but it's very difficult to be done. All right,
Sure.
let's wrap up this question and then we move on to the next condition. Yeah, another very common condition that we see usually is called cataract. So, Dr. Kenneth, can you tell us more about cataract? A lot of viewers would like to know about this condition.
Okay. So cataract is actually a very, very common condition. Example, like I told you just now, diabetic eye disease and cataract. If you actually go to WHO website, it's actually in the top 10 list of leading causes of blindness in the world. In WHO, website, you can actually go there. Diabetic eye disease and cataract is one of the top 10. So cataract is, so many people have cataract. So cataract basically is the clouding of your lens due to multiple factors. And most common, we're not going into the specific causes of it, I mean how it happens, but usually it happens commonly. It can be due to OH, and also maybe trauma, and also maybe due to some medication you take, it can cause cataract. And this actually is very common among our elderly people. Example, at your home, let's say at your home, you have grandparents, right? You have, grandparents or anyone elderly. You can actually ask them, they actually have this blurring of vision, for some time already. So most of them, they actually have cataracts and we don't even realize it,
What's the difference between cataract and also LOFA? Because some elderly, they may not be able to differentiate and describe properly.
Okay.
By vision.
So, cataract and LOFA is basically long-sightedness, right? In English. Yeah.
It's called presbyopia or long-sightedness, yeah.
Yeah, so basically these two things is a big difference. Cataract is basically your lens. Then, can you hear me?
Yep,
clear,
exactly.
right?
Clear. Yeah, clear.
Okay, yeah,
clear.
LOFA actually is basically due to the weakening of your eye muscles, causing your eye to be unable to accommodate, causing you difficulty in looking at short distance. That's why some of them need to wear glasses, right? So the best way, one way to detect this is very simple. Let's say you have an elderly patient, an elderly person in your house which has got eye problem. You don't know, right? It's what, right? So you go to a shop, an eye shop or something. So most of the, I can say, opticians or maybe optometrists, they can actually detect this. That's one good thing. We have many referrals actually from optometrists, they write a letter, because if you have a cataract, they're unable to check your eye power because they also have the instruments when they check your eye. When they check your eye, right, the power, they have the instrument, they can see, why is it cloudy? So they also can tell you that you might have a mild cataract. So they will refer you to an eye center. This is very common also. Yeah. You can
different kind of blurriness.
If you're worried, if you have elderly, not to say different, they can actually, because if you have a cataract, it's quite obvious. If you have the proper instrument, it's quite obvious. You can actually detect it from the instrument.
Are they different kind of cataracts?
Yeah, cataracts got many types.
What are the most common types? No need. Just two common types.
Okay, let's say nuclear sclerosis, or maybe cortical cataract, or maybe
speak English.
Yeah, that's why it's all very complete, like all medical terms. I don't know how to translate. Basically, the cataract. Okay, cataract is like your lens, right? Yeah, and that cataract can happen at the middle of the lens, or it can happen at the back of the lens, or it can happen at the front of the lens. Yes, so that's a simple term you understand. So cataract can be happening at the front of your lens, the middle part of the lens, or at the back of the lens. Yes. So
will the treatment be different for each type?
The definitive treatment, of course, is to remove the cataract and put in a new pair of lens, as I can say, in your eye.
So that's the definitive treatment for all type of cataract.
True.
So
how to avoid cataract? You cannot avoid cataract, because
just like you cannot avoid aging.
Yes, to stop aging. You have to stop getting old, yeah. But it's
I know, I
impossible,
know.
right?
Find the fountain of youth.
Because eventually everyone, even maybe people at their 40s will start having cataract. Maybe even you might have a bit of cataract, but you don't realize it. But actually, when you see under the slit lamp, when we examine your eyes, you do have a cataract, yeah. So, like I said earlier, a definitive treatment is cataract surgery, which is actually quite fast nowadays. You can do everywhere in private and also in government. As now, I'm actually in the cataract center, Pusat Cataract Mawit Taman Wayu. I'm actually at the cataract center under the government, which is under Hospital Selayang. So they
Is
actually
it
do
under the
provide.
same area or is it in a different location?
It's different. It's at Taman Wayu, but it's under Hospital Selayang.
I
Yeah,
see.
but yeah, basically the center only does cataract surgery, and
Oh,
we
day
actually
in,
give
day
them
out.
day in day out. One day they do about 15 cases now. I think 14 to 15 cases just cataract surgery. But however, we are selective only of certain cases for cataract surgery, because if your vision is very poor, then only we will proceed. If your vision is still okay, we do not proceed because of COVID. Yeah. If it's not COVID last
Oh,
time, whatever cataract also we do. Yeah, now it's
I
cataract,
see.
so we actually limit cases.
If we are not
Yeah.
talking about COVID time, what is the waiting list from the moment you get the referral letter from GP or
Hello?
optometrist?
Can you hear
Yeah,
me?
yeah, can. So my
Can you
question
hear me?
is,
Sorry,
Dr.
can you hear
Kenneth,
me?
yeah,
Yeah,
do
the
you hear
line was
me?
so good. Yeah, okay.
So my question
Yeah.
is, right, if it is not about COVID, if it's not during COVID time, let's say if I go to, how long will the waiting list be before I can get
Okay.
my cataract surgery?
Mm. So if you go to a normal government hospital, usually you need to wait at least 2, 3, 4 months to get a date for your operation. There's a very common scenario. You go to any government hospital, because there's a waiting list, there are many people. But in Pusat
Right.
Cataract Mawit, Taman
Same like
Wayu,
that. Some in dental also.
yeah, if you go to Pusat Cataract Taman Wayu last time before COVID season, even
Before
now
COVID,
also, if
yes.
yeah, even before and even now, if your vision is poor, if you want to give you a date, within 2 weeks you can get the operation date.
But
2 weeks, that's
it's
very
so.
fast.
How
Very
long has it
fast
been in
already.
operation?
Many years, I think. Pusat
That's
Cataract
good.
Mawit, I think it's more than, like, I'm not sure. I cannot give you specific how many years, but
No,
quite
no,
a
it's
few
fine.
years.
It's fine.
Yeah.
Oh, that's really nice. It's a
Uh,
such a good institution for all the Malaysians, right? Because
yeah, and
it's
also
such a common
mm,
condition.
the fee for operation is 103 ringgit. 103 for government lah.
Woo!
Government 103. Then the lens you pay yourself. The lens usually the price range is around 600 to 900. Then there's a wide
So it
variety
looks
of
like a
lenses from
contact lens.
not you can say that, yeah, you can say that contact lens, yeah. So
Okay.
the total cost is around 900 ringgit or for one
Wow,
eye,
that's
or 800 to
wow.
900 ringgit for one eye, yeah, in the
Mm,
government setting.
that's nothing compared to a private setting.
Yeah, private, I think one eye is few thousands, yeah.
So how about another common condition in seniors is presbyopia, the LOFA, right? Can you tell us a
Lofa.
little bit about that and how can they deal with it?
Okay, so basically Lofa, the one as I said earlier, you have to go to optometrists and you have to make glasses. Yeah, that's the simple answer only.
There's
Yeah.
no definitive
You
treatment
have
like cataract.
Yeah,
Laser?
there's no definitive treatment. Huh? Laser elderly, I'm not sure if they do. Because I cannot comment much on laser, because in government service in Hospital Selayang, we do not practice this. So I'm not really sure. Maybe private, I'm not sure, but yeah.
Okay. So this happens to everybody. I'm talking about when we actually open our eyes, right? Sometimes we see something floats in front of our eye.
Hmm.
A lot of people cannot explain what is that. Can you tell us more about this, Dr. Kenneth?
Okay. So I think what you meant is floaters. This is very, very common also. You can actually ask your grandma or ask your grandpa or even your parents, maybe you ask them. Sometimes they'll complain to you, Cantonese, they call it 飞蛮紧
Fei man
飞蛮紧
Jing. Oh, yeah.
Ah, 飞蛮
Even
紧
I'm the first time hearing it.
Okay, Fei Man Ting. You can
Okay.
see. Okay, and in Malay usually
Mosquito
we'll
flying.
say, yeah. In Malay
Okay.
we'll say bintik-bintik hitam terbang-terbang, ada color kelip-kelip mata. Then when the patient tell you when the other color I tutup mata, dah hilang. Buka mata, ada balik. Yes. So this is actually called floaters. And
Right.
floaters, actually many causes of floaters. Because floaters is actually a symptom. Many causes.
Oh, it's a
The
symptom, not a
first,
condition by itself.
yes, not a condition by itself. It's a symptom. So, for example, the first few one, it can be what I say, posterior vitreous detachment. It can be a vitreous hemorrhage, or it can be retinal detachment. So these are all medical terms, right? Okay, in simple
Come
terms,
back to English.
yes, come back to English. Yes, posterior vitreous detachment. For example, let's say your eyeball, right? Your eyeball, you got gel inside, right? When you are young, right? Your eyeball is, hardened. Your eyeball is, I mean, the fluid inside is strong lah. So as you
Yep.
as you become older, things become soft. Yeah, due to aging, you know. So when that fluid becomes softened, you can see things like it becomes more liquid, right? So you can see things flying in
Yep.
your eyes. Can you hear me?
Yep. Clear, clear.
Hello? Can you hear me?
Yes. You were saying that as we age, then things become more and more softer. Oh, we are losing Dr. Kenneth again. Dr. Kenneth, hello. Hey guys, leave a comment. How do you think having Dr. Kenneth here? Right? Are you learning a little bit more about eye health? While we wait for Dr. Kenneth to come back online. Okay. Hey. Dr. Kenneth got kicked out. Let's wait for him to come back again, yeah? Oh, cool, he's back. Okay.
Hey, sorry, my line not so good. Yeah.
No problem. Yeah, you were saying that when we get older, right, things in our eyes get softer and softer.
Yes, become liquidify. Yeah, in simple terms, liquidify. Then you can see things floating around. That's why you can see like the fluid. It's actually the fluid you're seeing in your eyes that's floating around. That's why you get to see things. Okay. And number two, which, okay, it can be due to eye disease, diabetic eye disease. For example, diabetic eye disease, like I told you earlier, right?
One of the
Can be
causes also.
yeah, one of the first symptoms. You can actually see things flying around. Then it could be diabetic eye disease, or it could be retinal detachment too. Retinal detachment is
Any of
the wall
our
of your eye.
viewers are seeing all these floaters in the eyes, please comment.
Because at the back of your eyes, what is it? Sorry?
Neotin. He said can see spider crawling.
Like then need injection already. Need injection.
Need injection. No, you need injection. Yeah. At the back of our eye, you were saying?
Your eye, your retina, right? Your retina is flat usually. Yeah, the back of your eye retina is flat. So let's say if it's detached, it can cause floaters. So it is one of the symptoms also. So a floater can be normal, a floater can be abnormal. So better get checked. But most importantly is if you realize the floaters are worsening, then you should come to the hospital quickly. Because sometimes if the floaters are not worsening or maybe a bit on off, it could be normal. But if it's persistent, if it's worsening, then you should come to a hospital for eye checkup. Because if you, like I said, if you detect early, then we can treat the cause. We can find the cause and treat it.
So this is O Sisu. He asked, is floaters curable? So when it's early, before moderate stage, it's curable. But after that?
Not to say it's curable. the more important thing I can say is to find the cause of it, because it cannot be 100% curable. It's impossible to say it's curable because somehow you still have a bit of floaters one. Impossible, no such thing as you do 100. So it's impossible to say it can be 100% curable lah. You will still have floaters no matter how somehow.
Oh, I think I missed this comment earlier. Can you tell us the types of lens available? I think she's talking about cataract, like what are the types of lens available and the sustainability of the lens for individual patients?
Okay.
Thank you, Neo, for the question. Yes, Dr. Kenneth.
It's a very good question because many of our patients actually ask this when they come cataract, Doktor, kanta apa yang lebih baik? Yang lebih murah ke, lebih mahal ke apa? Okay. So for our government setting at hospital, I can comment about my government setting first lah. In our Pusat Cataract Center, usually we'll use monofocal lens. Can you hear me? Because your video is stuck. Can you hear me, right?
Can.
Can you hear me?
Yes, I can hear you. Yeah, please continue.
Can you hear me?
In government setting, you said monofocal.
Can Okay.
So you're talking about monofocal.
Monofocal. Yeah. Can you hear me?
Yeah.
Okay, we'll use monofocal lens. There's monofocal lens, bifocal, trifocal, or toric special lenses. But in government practice, mainly they use is monofocal. Monofocal lens correct far vision. So basically, when you do your lens already, you can see far. But when close reading, you still need to make glasses for reading. So most of the government centers, they do monofocal lens only. But when you go to private, they might do a bigger variety like bifocal, trifocal, and also maybe toric lenses. Because these lenses can also correct not only long-sightedness, they can correct intermediate and also short. Yes, and also
so the focal. Does it mean the more the merrier?
More what? You mean more? The more expensive ah.
But at the same time, it can correct more condition at the same time.
Yes. Not to say condition, but it can improve the vision at different levels because your vision can be long vision, intermediate vision, short vision, and it can be astigmatism. So the lenses can work as in like they can correct your vision at which level. Because monofocal is actually the cheapest option. That's why I think most of the government centers uses that. Yeah, private maybe you can find a bigger range. But still,
is there an option for us to pay more and get a better one?
But still, actually, at the end of the day, it depends on the surgeon skill. Some surgeons might use a cheaper lens, but still the visual outcome is good. Yeah, some surgeons might use an expensive lens, but the visual outcome is poor. So it depends on an individual. Yeah, the person operating, and also what type of lens. Yeah.
Neo is very interested in this topic. He says, he asks, I can read without reading glasses now. What type of lens is suitable for me? Thank you.
I think the person meant cataract lenses, right? Should be the cataract lens, right? Yeah. We do not say in government survey, we do not support any brand specifically. I do not say, oh, I love this brand, then I must support this brand. Because from what I understand is there is a fair distribution of companies, of choosing lens companies. For example, you come to Pusat Cataract Mawid. Let's say today is this lens A, then we'll use lens A. Tomorrow is lens B, we use lens B. The next day is lens C, then we use lens C. There's no bias lah. Because every lens has their own pros and cons, Because each lens company will tell you different things. Maybe I got more super technology, Maybe my lens, the kaki more better one than the lens, or maybe my lens is clearer. They will tell you different things, yeah. But we do not have a specific brand. Yeah, it depends on your surgeon also in private. Let's say if you go private lah, maybe in your private center, your doctor is more comfortable using this lens.
Correct.
So the doctor will suggest to you to use that lens.
Correct.
So it depends on your surgeon also. Yes.
It affects the technique of the op also?
As I said, it depends on the surgeon, because different lens got different ways of implanting. So if your surgeon is so used to using lens A, you go ask the surgeon to use lens B, then the surgeon might not be comfortable, Let's say, yeah. Then,
So yeah,
sorry.
then.
Okay, so lenses are short one lah, about price lah.
Mm.
The lenses price, actually, to your shocking belief, it's actually very cheap, cost price if you come to the government. The lens usually maybe cost 650 ringgit and 700 ringgit or 800 ringgit. And this lens is actually the same lens as private is using. So the price, actually government, they're giving you very cheap already. The cost price of the lens is only 600 ringgit, but in private it's more expensive lah, as you can
Definitely,
see. Yeah.
they need to add up other costs and their profit as well.
So government doesn't make any profit. Yeah, will it be a long queue? As I said, maybe now will be a longer queue because it's COVID season. They are very selective on cases. For example, like my center now, they only do cases where your vision is poorer than 360.
360 meaning?
There's a scale, 660, 360. So I don't know how to say meaning, but you have to examine your eye lah. Then you can say, like, you cannot see a certain distance, then only we do. But if your vision is still okay, we will postpone your case because of COVID. Yeah.
I see.
Yeah.
So yeah, I don't think I want to take up too much of your time. Yeah, I have already taken up your 50 minutes. So yeah, let's wrap it up before we leave. I would like to know, Dr. Kenneth, as a general advice, how would you advise our viewers to take care of their eye health?
Okay. Eye health, I think everyone will tell you the same thing. You scold your kid every day, don't play too much computer, don't play too much phone. Now everyone would know. So
what is too much? How much is too much?
I won't say, I'm not sure how much is too much. I mean, it depends on individual. I don't, you have to read online lah, like how many hours, you cannot see. Yeah. It's up to your own description. Your discretion, like your family, like, I cannot play too long, whatever. But the most important is, go for at least proper yearly follow-ups. Let's say even you have hypertension,
Yep.
You know that hypertension actually can cause eye disease, and there are stages also of the eye disease in hypertension. It can be stage 1, 2, 3, 4, 5. So don't think that, hypertension, you won't get eye problem. You can get eye problem from hypertension. So it's better to go to your ophthalmologist for eye checkup if you have hypertension, diabetes. Just go for 1 yearly checkup. Yeah. And these two is just one of the most common things. There are many hundred more things that you need to look out. I mean, not only hypertension eye disease or diabetic eye disease or retinal detachment or cataract, there are so many other conditions. So it's better just to get a routine checkup.
Is just a normal checkup in an optician enough, or do we have to go to a hospital that is more recommended?
For me, of course, the best, is going to the hospital. Going to the hospital, get a proper checkup from an eye doctor. Yeah. But now, because of the COVID season, usually I would suggest patient not to go hospital unless you have symptoms. Unless you have eye symptoms. For example, floaters, or maybe blurring of vision. Yeah. We do not want people to come to the hospital because it can be dangerous. Yes, it can be dangerous. I mean, because of COVID, right? We don't want people together. Yeah.
Probably postpone it a little bit unless you're really symptomatic, like your vision is really getting blurry, really with floaters and all that, right?
True.
Yeah, Haley Wong said, early screening. Yes, that's very, very important.
Yeah.
Yes.
Early screening.
Any other general advice for our daily life to take care of eye health, like all these eye protecting supplements and all this? What is your comment?
Supplement, in government hospital, I can say in government practice, generally we do not really give supplements for the eye. I do not sell any products to my patients. I do not tell them, to eat this special pill to improve, but maybe they can. I would just tell the patient, maybe eat more fish or something, get more vitamin A for your eyes to prevent night blindness.
Eat more fish,
Yeah,
vitamin A.
Yeah. So that's all. Yeah, supplements wise, I do not suggest. I do not suggest my. I do not tell my patients to buy any supplements. Yeah,
Mm.
maybe
Some
you
are
go private.
saying,
Maybe you go
mm.
private. They will ask you to buy supplement. Maybe I don't know.
All right. So supplement is not more important than screening, right?
Yeah, can say
Mm.
that. Yes.
Is it necessary every 6 months we do eye screening? This is Abigail
Not
Lim asked.
not necessarily. Not
Mm.
necessarily. It
Annually
can be
is fine, right?
yearly. It can be yearly also. Yeah. And if you're very worried, you can maybe just go to optometrist lah. Yeah. Because
Optometrist. Mm.
many patients and many people, they actually have what we say refractive errors. Basically, short sightedness and long sightedness problem, but they don't realize it also. They don't realize it
Mm.
that they actually have this problem. They only need to wear specs or then you'll be surprised, Then you'll be like, oh, your eye got sankong, astigmatism.
Mm.
Then you
Yeah.
need a surprise. Nobody knows actually until they go for a checkup lah, like another optometrist, yeah. And if they actually think you need a referral, they will refer you, yeah.
At least they are the profession. They may not be handling the treatment, but they are the ones that can recognize your issue, your condition, your problem, and make an appropriate
True,
referral to the respiratory doctors.
true,
So
true.
JDCG, anything wrong to have watery eye after long talking? Okay, that's okay. Yeah, Dr. Kenneth.
So long talking, how long talking? Maybe my eyes are watery already a bit now. Okay,
Yeah,
so
maybe get some rest.
watery eye also is a very common complaint, A very common complaint daily. The patients will tell you, the eye is watery, or they can feel like you will feel like something is in your eye. The patient will tell you, oh doktor, mata saya macam ada sesuatu dalam sentiasa ada berair dan ada kala tak selesa. You feel discomfort, you don't feel well. The common cause you can tell your patients, or you can you examine. It could be dry eyes.
Oh,
So yeah, dry eyes. So basically, the first layer of your eye, the cornea, it is dry, so you need lubricants. So you actually can go to your nearest pharmacy. You can buy eye drops, artificial tears, with no preservatives. Okay,
why
with
is that
no
important?
preservatives. Yeah, because some people might be allergic to preservatives. So after putting the eye drop, your eye might become more red and more discomfort. But the no preservative free one, you can actually put the eye drops maybe every 4 hours, every 2 hours, and it will improve the dry eyes. And it's a common thing also because many people, they are working in the office, or they are working till late night, working from
Always
home,
looking at screen.
looking at the screen for a long time. When you look at the screen for a long time, your eye blinks less. So when your eye blinks less, then your eye surface become drier. Because when you blink, you give a protective layer, right? So when you don't blink, then you form dry eyes. So you feel more discomfort and watery, and you feel a bit like watery at that. Yeah, the feeling.
As you are talking, right, I'm blinking more.
Yeah, that's why my eyes are water already.
Yeah. So, will there be any dependency effect if you use that kind of eye drops? Like, well, if you stop using it, then suddenly you feel more dry.
So far I never hear complaints from patient that you stop using the artificial tear, then become more dry, because generally the artificial tears for preservative free is quite safe. Yeah, preservative free is quite safe because there's no preservative, right? There's nothing there that can cause your eyes to have allergy or anything. It should be quite safe. Yeah, shouldn't be an issue.
Abigail has another question. For kids, how young can we send them for another eye check? What is the recommended age?
For kids, actually, you can start off by sending them to the optometrist. That's the most basic thing, as I can say. The spectacle shop, because let's say if your kids playing too much devices or something, they can get their eyes checked there. Because that is the easiest thing. As I said just now, the optometrist, they can detect any problems. Because sometimes children, not necessarily, it could be due to long-sightedness or short-sightedness, It can be due to some underlying eye conditions. And the optometrist might detect, the optometrist might feel, like really weird, because sometimes when you're doing it, right, when you examine the eye, they can feel like, this child, even though I put the power already, still cannot see properly. So they'll refer to the hospital. Because some children might have very high astigmatism. Sankong.
Yeah.
So sometimes in children, they might have very high astigmatism, then they refer to the hospital. Then you must find out the cause of the astigmatism. Yeah, then we'll investigate more.
Oh, poor thing. So young already, cannot see
Yeah,
clearly, cannot see blackboard and all that.
Yeah.
It's okay, but once we get a correct diagnosis, get a correct treatment, or even correct type of glasses, then the problem can be solved, right?
True.
All right. So, Neotine, is taking lutein advisable? Does it have any relation to eye health?
From what I understand, lutein is actually vitamin A, right? Vitamin A, from what I understand. So outside, I think you can see pharmacy they sell the lutein tablets everywhere. I think whatever brand also they have. Yeah. So as I said, I cannot suggest any brand to you. Best you eat food that has a lot of vitamin A lah. Example, maybe egg yolk, broccoli, maybe orange. Yeah.
The best type of supplement is still food, yeah, because it not only supplies the nutrients, lutein, but also all kind of complex nutrition.
And
Besides
somehow food is not a very big problem in Malaysia, I think. So
correct.
far, I think everyone is quite eating quite well in Malaysia. So you don't
Too
really see
much.
people so you don't see people lacking of the vitamin. People don't come to you, and lacking of this vitamin causing it to have this. Usually not so common in Malaysia. I mean, so far I think maybe it can happen at some other communities, like deeper communities, but usually it's not so common. Yeah.
All right, so the life has gone 1 hour without us realizing. So thank you so much. So before we end, Dr. Kenneth, would you want to add any more things to the viewers? Any more points?
First thing is get vaccinated. Go register my suggestioner app. Yeah. And help the elderly get registered, because elderly people sometimes they don't know, right? They don't know what to do.
Right,
So
yeah.
actually you can use your app and you can register for them under your app. That's the first thing you can do. Second thing is stay home, don't go out now. Cases are rising very bad. You can see thousands of cases per day. Yes. And even the healthcare worker, they are falling sick. Yeah. So the general public can even become sick, easier to get also, because when you go outside, but now most of everyone's staying at home, right? Am I right? Everyone's staying at home, right? Working from home.
Yeah. Oh, I am not. I cannot work from home.
Yeah. Ask people
The
come to
viewers
house,
are. The
Huh?
viewers are. The viewers are working from home. Our viewers are very good people.
Yep, that's all lah. Nothing much really lah. Yeah, just to stay safe only lah in this COVID season. Yes.
All right. So again, I want to express my gratitude and thank you so much for coming out on Gigihan, our first live. So guys, thank you so much for staying till the end. If you think this live is helpful, informative, and you think Dr. Kenneth Wong is handsome, please help me to share this live session, the recording of it, to all your friends and family so they can get more information of the current COVID season, and also we can get more information on our eye health and help us to know how to take care of our eyes. So the main point takeaway today is get your eyes checked at least once every year. So yeah, thank you so much, Dr. Kenneth.
It was good sharing with everyone, because some people might think, eye so small. People like, never mind. But you must remember, eye is very important. Let's say if you lost your hand, if you lost one of your hand, you still got the other hand. If you lost your leg, you still get a leg. But imagine your eyes, you lost your eyes, you're blind,
Your
you cannot do
world
anything.
will be dark.
Yeah. You lost your kidney also. You lost one kidney, you still have one more kidney. So no need to worry. But if you lost one of your eye, you're partly blind, you cannot do anything, Imagine if both your eyes are blind, then you can't even, example, you can't even go to the toilet, you can't even do simple things like maybe, eat. it really affects your daily life. So the awareness is actually very important. People might think it's a small organ, but it's actually a very big thing.
So yeah, okay. Once again, thank you, Dr. Kenneth. I really appreciate you came on here. And so
Thanks.
probably we'll see you in the next session. All right.
Okay.
Thank you, guys.
Bye.
Bye-bye.
Bye.